Hi, I'm Joe Namath.
Call the Medicare Coverage Helpline.
Speak with a licensed insurance agent.
Now is the Medicare annual enrollment period.
Call the number on your screen now. It's free. Free. Call the number on your screen. Call the number. Call the number on your screen now.
The beauty of traditional Medicare is that it is based on that principle of simplicity and universality that make policy so effective.
Original Medicare was a godsend and has saved so many lives over the years.
Medicare has no delays, no denials. The doctor says you need something, you get the care that you need. Industry looks at that and they're like, We're going to smash that to smithereens. We're actually going to privatize that. What the insurance companies were brilliant at is getting it named Medicare Advantage.
It's really, in my view, a scam.
If you go out right now and ask most people, they do not know that there are two systems. They don't know that these are fundamentally different things. These are corporations ripping off the American people to the tune of $140 billion a year. The grand con of privatized Medicare is that all you've done is put a middleman in between the same exact system.
These companies operate death panels. They are able to call the shots, overrule doctors and their decisions, and refuse to pay for things that can be life-saving. It doesn't happen in traditional Medicare. That happens every single day to people of all ages, but increasingly for people who are enrolled in Medicare Advantage plans.
My mom was on Medicare Advantage. In her late 80s, she was in assisted living. She lived in her home as long as she could. When she actually needed care for something, there was a doctor who came to her assisted living facility that if she was on Medicare, she could have saw that doctor. But because she was on Medicare Advantage, that doctor wasn't in the network offered by that private insurance company, and she would have had to go all the way across town to get that care. The problem is she wasn't very mobile and she never got the medical care.
It means that there are delays and denials that lead to harm and death.
Came to understand the unrelenting pressure from Wall Street on health insurance company executives to spend less and less on care just so they can boost their bottom line.
Medicare Advantage is not Medicare.
So we want to stop private plans from calling themselves Medicare.
And that's why we've introduced the Save Medicare Act. The Save Medicare Act is a fantastic piece of legislation.
It would prohibit private insurance companies from even using the name Medicare.
So what the act does is just by law says you're not allowed to take this name, which you are not. You have no right to call yourself Medicare anything when you have 10,000 people dying a year because of the 5% worst performing Medicare Advantage plans. That demands government action.
Only Medicare is Medicare.